Fixing knee problems thoroughly means you need to take care of your calf strength. It's often one of the most overlooked muscles when it comes to strengthening your leg muscles for a knee problem. And in today's video, I'm going to go through 5 exercises that you need to be doing to strengthen your calf muscles to support your knee problem, as well as possibly fix a foot or ankle problem that you might be dealing with that's connected to the knee problem. Sadly, too many people deal with knee problems and they're looking at strengthening their thigh muscles or their hip muscles when the biggest problem could be coming from the calf muscles and even the foot, which some of these muscles will influence. So we'll talk about all that today. Real quick, my name is Dr. David Midoff, and I'm a specialist physical therapist at El Paso Manual Physical Therapy. And this channel is focused on helping people stay healthy, active, and mobile while avoiding an unnecessary surgery, injections, or medications. Please subscribe to this channel so you don't miss out any of the helpful videos we put out every single week. Before I show you these exercises, let me just review the 5 muscles of the calf area. Now you won't be able to see them on our model here. Go ahead and flip around real quick. So I'm just going to point to where they're at and just kind of how they run so that you know where you're at on your own leg when you go do these exercises. So on the most superficial part of the leg, you have the gastrocnemius muscle. And right below that, you have the soleus muscle. Both of those muscles run down together to the Achilles tendon down here. A lot of times people will have Achilles tendon pain, Achilles tendon issues, even ruptures or tears that could be setting up a knee problem up higher. Below that, you've got some deeper muscles. There's 3 main ones: flexor digitorum longus, flexor hallucis longus, and posterior tibialis. The flexor muscles, hallucis longus and flexor digitorum longus, help you to curl your toes. The longus hallucis is for the big toe, and then the digitorum one is for all the other 4 toes. The posterior tib, go ahead and turn around this way please, is to help you to raise your arch. It's an arch supportive muscle. So are the flexor hallucis longus and flexor digitorum muscles, but the posterior tib is the one that directly attaches on the inside of the arch, and it's one of the main ones responsible for pulling up the arch, which is a big deal for setting up the right position for your knee joint so that you can decrease the pressures in your knee joints and set it up to heal for the long term. You can heal from problems like arthritis with this, meniscal tears, meniscal injuries, ligament problems like ACL tears, MCL tears, LCL and PCL tears, as well as patellofemoral pain syndrome and other cartilage problems that happen inside the knee. The first exercise that I want you to do, number 1, we're going to get familiar with doing a proper toe curl exercise, because this one is going to connect over to the rest of the exercises. So once you have a seat here, when it comes to strengthening your toes, having full range of motion and strength in a toe curl is very important. So I'm going to just put your leg up here on my knee here. So what I want you to do here is curl your toes as far as they can go. And what I want you to pay attention on yourself at home is do these knuckles right here pop up, and do all the knuckles bend in your toes. Just like your fingers, you can relax. They have knuckles here that's in line with these, and knuckles throughout. And of course your thumb only has 2, so does the big toe. It only has 2 right here. When you curl your toes, I want you to do a hold as long as you're not cramping. So go ahead and hold it right there. And you can see here she's having trouble bending these joints out here. Go ahead and relax for a second. But if I bend her foot, she can actually bend those a bit better. Go ahead and hold it right there. Try not to let it go. And here's your first exercise right here. I need you to curl your toes and hold it for 10 seconds and try to get these joints right here to bend as best as you can, as well as all the other joints in the toes. So I'm going to give your leg back here, and let's do it on both sides at the same time. So curl the toes all the way and work on getting these to bend. A common problem here is getting cramping in the arches of the foot or sometimes in the calf area. If you're getting cramping or it feels like it wants to cramp, back off on the intensity. Ideally, you want to go 100% on this toe curl exercise, but if you're getting a cramp, say at 70 or 80%, just back off right before the cramp starts and hang out there and hold the exercise for 10 seconds. And we'll do this for 10 reps at a time so that you can warm up those flexor hallucis longus, flexor digitorum longus muscles, and a little bit of the posterior tibialis muscles in your calf. Let's do one more here at home. We'll do 10, of course. And then I'm going to show you how this translates into the rest of the exercises that we're going to do. Good job. And you should be feeling the muscles work in the meat of the foot, like usually in the arch area, and usually in the lower part of the calf, not so much the upper part of the calf. Once you've gotten an idea of how to curl your toes, then what I need you to do is just practice it in standing, just like this. So without curling your toes under your foot, just press your toes down flat a bit. So go ahead and do that. Yep, you got it. And that engages those toe curling muscles. You're going to do this in preparation to do a heel raise where you're lifting up your heels. So relax them for a second. Let's have you turn around and hold on to the wall for support. So at home, find a sturdy surface like a couch or a counter, a wall, as she's doing here is perfect. And before you start lifting up your heels, grab those toes. Go ahead. There you go. Hold your toes just a bit grabbed here, and then you're going to lift up your heels. Yep. Hold it there for about 10 seconds. And you're trying to go as high as you can to make sure that you use those big calf muscles, the gastrocnemius and the soleus. After about 10 seconds, you can come down. The whole time that you're holding, you need to be grabbing with your toes just a bit. Doesn't have to be 100%. You don't want your toes to curl. You want them to remain flat. And do 10 reps like this at home as well. We're gonna speed through them just a bit. We're not gonna do all 10. I want to make sure I show you the rest of the exercises. So you're working on getting as high as you can. Perfect. We'll do just a few more reps. I'm going to highlight a couple of things for you here. So watch when she comes up how the heel bone here just tips inwards a little bit on both sides. That's good. For me as a physical therapist, that tells me that she's using her posterior tibialis muscle, one of those calf muscles, the one that supports the arc. She's using it well. If you can have somebody watch you do this, or if you can set up your camera on yourself and do some heel raises like this, and see if your heels are coming slightly in, because if they're not, one of the exercises I'm going to show you in a bit is going to be really important for you, so make sure you watch the whole video to catch that exercise. Good job. We'll do one more here. So make sure you grab toes first, then come up and count to 10 slowly, and you should be starting to get tired in those calf muscles. Fantastic. So once you've done that, you might hang out here. If you're weak and you had some difficulty doing that, if you couldn't come up all the way, you felt like you were missing some height, then you might need to press on the countertop that you're using or find a couch to kind of help you with your hands. But if you can go up all the way and hang out up there for 10 seconds, you're ready for the next one. Let me show you that. So now you're going to stand on one foot, and I'll show you in between in a second, but let's have you just pick up one foot completely for a second. Then same thing, we're going to do a single leg heel raise. She's holding on for balance. Go ahead and grab with those toes and then come on up. And she's fighting to come up. Come on up all the way. Use this muscle, grab with the toes a little bit. Perfect. And the key on this one is making sure you come up all the way. It's a lot more effort on that one leg. On this next rep, if you can turn to your right and do the same thing just to get a side view here. So you can see here she's going to grab with those toes, perfect, and then do a heel raise all the way. She's holding on for some balance, and she's using all the muscles now, working really well in the calf area. Yay. All right, so let me show you how to modify this. If you're strong enough to do the two legs coming up, but you can't quite do a single leg, let's have you face the wall here again. And what you're going to do is think of this in percentages. So if standing on both feet is 50% body weight on each side, and standing on one leg is 100% on one leg and 0 on the other, let's find 60-40, 70-30, 80-20, and so forth. So let's have you just lean over to let's do your right leg here. So put about 60% here. It's okay if you even kind of just are on your toes or you lift your foot slightly, and you're doing 60-40. Grab with the toes on the right foot and then go ahead and come on up. There you go. This is the third exercise for you. You're offloaded here, but you're still doing more work on one side than the other side, so you can get this stronger. You need to find the right percentage mix so that you can come up all the way here without dropping, and you're still using the right muscles in the calf and you're grabbing with your toes. If you feel you can do 60-40, then go ahead and go to 70-30 or 80-20 or 90-10 or whatever number in between you feel like you need to be working at. The keys here are you need to have your toes grabbed and you need to be coming up all the way. If you're only coming up halfway here or 70% up of what you can do all the way, you're not working out your calf muscles, all 5 of those that I talked about, as efficiently as you can, and it could be leaving your knee at a disadvantage whenever you go walking or using it to exercise, do the things that you need to do that could be setting up your knee for that pain that just doesn't want to go away. Let's do one more here. Why don't we go 90-10, so you're going to barely be holding a foot down on the left and doing a lot of the work on this side. Great job. Still grabbing with those toes, but keeping them flat, not curling them. Yay, good job. And it takes some focus for sure to kind of tune in and make sure you know what your toes are doing. Okay, so just to catch up to where we're at, the first exercise we covered was those toe curls. The second exercise we covered was the heel raises with both hands on the wall, 50-50. The third one was shifting your weight over like we just did, and I kind of got ahead of myself. The fourth exercise is coming all the way over to one leg and doing 100% heel lift on one leg. So the fifth exercise I want to show you here next is to fix that little heel position that I was telling you about. Now, Amber's heels go in together pretty well, but when you come up, go and do a heel raise real quick. If your heel bones deviate outwards, are you able to demonstrate it? Just kind of, yeah, she can't even do it. Now go ahead and come back in. The bottom of the heel will kind of bend outwards here, and it's usually if you have collapsed arches, you can rest. Then you need to do this exercise. Now I'm going to grab a lotion, little mini tub of lotion that we have here, and I want you to bring your heels around that like you're going to grab this with your heels. You can use anything, like a ball works really well, a rolled up towel, and it needs to be a little further back, just about right there. And you're going to, yeah. Okay, so go ahead and grab it with your heels. You're going to do the same heel raise, grab with the toes first, and then work to pick it up. There you go. And you see how you have to push your heels inwards to be able to grab it? That makes your posterior tibialis muscle work better, which is going to help you with your fallen arches, because that's the main one that helps you to elevate your arches. Great job. And you'll do this for holds as well. Now, some bonuses that you can do, you can rest there for a second, is I've only covered holds. So it's where she's grabbing with her toes and then coming up and holding. I've even talked about repetitions where you're coming up and down repeatedly. That would be the next progression. So you can now bring your weight on both feet, 50-50, grab with your toes. Here's a bonus exercise here. And then go ahead and come on up all the way. Go ahead, lift both heels all the way up, and then come right back down and do this for reps. Let's do 10 reps here, grabbing your toes every single time that you come up. That is the next progression. And then after that, you would go to that off-weighted one where you're putting like 60-40 or 70-30, whatever mix you want, and you're still coming up and down, but with following the same rules, making sure that you grab with your toes right before you're about to come up. And on the descent, on the way down, you need to still be grabbing those toes as well. Good job. You can rest there. So those are some great exercises to start strengthening your calves. If you're wondering how often do I do this, how frequently do I do it, it really depends on if you try this out. If you found that you're kind of weak or you get tired really quick, then you might need to be doing it a bit more often right now. The holds, I would recommend doing them 3-4 times a day or more. If you're not strong enough to come up all the way and sustain it, then you need to be working on the holds so that you can work your way all the way, so you can work your heels all the way up whenever you do a heel lift exercise. And then work to doing it so that it's weighting one leg more than the other. The next advancement after that would definitely be to add weights. You can hold weights in your hands, or if you have access to like a gym with barbells or some machine at the gym where you can come up and down, still grabbing with your toes, that would be the next level from there. But there's a lot of strengthening that you can get just working with your own body weight at home. Guys, if you thought this video was helpful, if you learned how to strengthen your calves better, please give us a like and subscribe so you don't miss any of our helpful videos to keep you healthy, active, and mobile while avoiding unnecessary surgery, injections, and medications. Have a wonderful day, guys. Bye-bye.